Good evening, welcome again, and once again we are going to continue with this same topic, which is my favorite topic, which is endometriosis. Okay, we have spoken already for 2 weeks answering your questions, and today I shall continue with more questions from all of you. Okay, I have to thank all of you for your questions, and I need your questions to keep coming so that we can have more and more sessions on endometriosis. Okay, so let's go through some of the basic that we have done. If you have missed the previous videos, I have a video in my YouTube channel. You can go to my YouTube channel, which is Dr. Tan City Clinic. Just click on to the link that I provide in this post. Go to my YouTube channel and go through. There's so many topics there that I've done since the beginning of the pandemic last year. And go and look for topics on endometriosis and things that are all linked to endometriosis. There's so many endometriosis videos in the past, more on the basic and general understanding of what is endometriosis. But what we have done on top of that, that is the last 2 weeks. First week, we did very much on how to detect endometriosis, what kind of scan and what are the situations and why it is sometimes difficult to detect endometriosis, but actually there are ways to go about with it, which I mentioned in my first video of this series. And last week, very interesting, we had very interesting questions that came in, and we had a very good explanation as to when a cyst need to be taken out, what is the point where you need to operate on a person, and also on a case where after surgery still a lot of pain and what you need to do. Okay, so that is mainly what happened last week. So let's see what's going to happen this week. So if you have missed any of my previous videos, please go to my YouTube channel. The link is in this post. YouTube channel is Dr. Tan City Clinic, and browse through the endometriosis related videos, and also go through all the other videos, because a lot of other things also very much linked to endometriosis. There are a lot of things that are also linked to endometriosis. So when you go through other videos, you will also see a lot of other things that I will mention. Even though the topic is not endometriosis, but I actually talk about endometriosis as well. Because endometriosis is a very wide problem. It's a very wide problem that involves so many things. And also, the last 2 videos, if you miss it, you just go to my YouTube channel, yeah. And then for those of you who are regular viewers of YouTube channel, please subscribe to my YouTube channel and click on the notification button. Okay, all right, so today I'm going to, last 2 weeks I've been using questions from my own Facebook. Today I will try to have a mix. Okay, I'm going to have the first question from the support group Endometriosis Malaysia. Most of the questions are in Malay language, but not an issue. I will just read it out first, and then I will roughly summarize the question in English, and I will go on explaining about those questions that were posted up by Endometriosis Malaysia. I want to thank the members of Endometriosis Malaysia. I know some of you are following my videos. Thank you for posting up some very interesting questions. In fact, there's so many questions from Endometriosis Malaysia. So I will do one from there, and if I have extra time, I'll pick one from my own Facebook again. So if you have any questions anytime along the way, just put it in the comment section, okay? Let's look at the first question that is by Zura Hassan. He asks in Malay, Doktor, adakah pengambilan ubat tahan sakit setiap bulan akan memberi kesan kepada buah pinggang? Contoh seperti dikloran, dan adakah pengurangan pengaliran darah sewaktu mengambil ubat tahan sakit akan memberi kesan kepada endo? Jika ya, adakah cara lain sebagai ganti kepada ubat tahan sakit? Adakah Panadol boleh membantu? Thank you, doctor. Okay, so if you were to read this question, what it means is he wants to know whether there's any problem if she were to take painkillers like dicloran, which is diclofenic acid, or some people call Voltaren. So there are many names to this medication. Is there any side effects if I take it every month? And she said that because when you take Voltaren or dicloran or diclofenic, you actually have reduced blood flow. So she also asked, this reduced blood flow that you get with this medication, painkiller, will it cause any problem? Because everybody very worried when the blood flow become less because they worry that endo will become worse. And the last question she asked is, if there are issues with this medication, what are the alternatives that can help? She asked whether Panadol helps. Panadol is paracetamol. Will it help? That is her question. So her question is four questions in one question, in one comment. The first question is there any problem if she were to take Dicloran? Her name is Dicloran, but I prefer to call it Voltaren because it's more popularly known as Voltaren or diclofenac acid. So is there any problem with this medication? And the answer is yes, because Voltaren it belongs to a group of painkiller we call NSAIDs. NSAIDs is a very big group of painkiller, and it works very well with endometriosis because endometriosis is basically a disease of inflammation. So NSAIDs are anti-inflammation because NSAIDs stand for non-steroidal anti-inflammation drug. So it is anti-inflammation. So endometriosis is inflammation. So if you take any anti-inflammation, it will reduce the pain of endometriosis. It doesn't cure your endometriosis, yeah? Painkiller don't cure your endometriosis. Endometriosis will still be there. And in fact, your endometriosis will still continue to grow more and more and spread more and more. The only thing it helps you is the pain. So because it's an anti-inflammation, so it reduces the pain. So it's very effective. But the main side effect of NSAIDs, which involves Voltaren, Ponstan, naproxen, there are many NSAIDs that people take. Indomethacin. There's really many NSAIDs out there, and they all help. But only thing is, it has side effects. What is the side effects? One is mainly the main thing we worry is actually damage to the kidneys, because NSAIDs can actually spoil your kidney. And also another one that we very worried is gastric pain. NSAIDs are very famous for causing gastric. And Voltaren, which is what she mentioned just now, diclofenac acid or Voltaren or Dicloran, is the strongest NSAID. So it is also good. It's good because it's very strong, so it's very effective as a painkiller, but it is also very much worrying when it comes to side effect. That's why I principally believe that, this is my principle, one should not live on painkiller. One should not live on painkiller. That's not the way you solve endometriosis. Why? Because number one, painkiller has side effects. Number two, it does not control your disease. Your disease continue to progress. You feel less pain, but your disease continue to progress. You should not live with painkiller. You should find a way to solve your problem. You should find other ways to solve your problem. Not painkiller. Because her next question is, if I take this, because this medication reduces the menstrual blood flow, does it have any effect if now my menstrual blood flow is reduced? That you don't have to worry. It doesn't cause any problem. But still you need to understand that your endometriosis continue to progress. Then her last question is, whether it is, what are my other things that I can take or do to reduce my pain? And last, she asked also, is Panadol effective? Oh no. Panadol is a good painkiller, not strong enough, not as strong as diclofenac or Voltaren, but it has no anti-inflammatory function. So that's why it's not so effective for endometriosis. So Panadol is not a good option if you are already taking diclofenac. Let's say you don't have very bad period pain. Of course, Panadol help because it's not very bad. But as you get worse, you upgrade your painkiller. So because you upgrade your painkiller until you reach diclofenac or Voltaren, which is already very strong, going back to Panadol will not help. I think that I had one video on coping with endometriosis that I did last year. Coping with the pain of endometriosis. So in this video, already I mentioned, you should not be on painkiller as your solution. Because going on painkiller, you keep upgrading your painkiller. You will keep upgrading and get stronger and stronger and stronger. Because your problem is not solved, your disease continue to progress because you're on painkiller. Not because of the painkiller, but because you're not on any treatment. You let your endometriosis progress. So that is why your disease continue to progress. So at the end, you also keep progressing on your painkiller, which is not the way to go. Because endometriosis is not a disease that cannot cause harm or cannot cause life-threatening problem. Endometriosis can cause death. Endometriosis can cause harm. So it can kill your kidneys. It can cause injuries to your lungs. You cannot breathe. It can become cancer. It can make you have cancer and die as a result of cancer. So cannot. So what are the things you can do? There are two things that you can do. Basically two group of things. One is to actually treat your endometriosis. Get your endometriosis treated, for goodness sake. That is my opinion. Treat it. Properly treat it. It is a treatable disease. It is a treatable disease. But some of you may say, Allah, treat already also come back. No. It is a treatable disease that is not supposed to come back unless you did not do what is right. Now the question is, what is right is wrong. I may leave it to another question to talk further. So basically, there are two ways to solve this problem. One is to treat the disease. Properly treat the disease so that it's gone once and for all. I had endometriosis surgery done 20 over years ago. It never came back. Because thank goodness I'm a gynae. I know what to do with myself. And I don't care what other people tell me. I know what to do with myself. So I do what is meant to be done. That is the first option. Treat it properly. You want to know what is treat it properly? Go to my old videos. The basic on endometriosis I did mention as well. Alternative number two is we want to find pain relief methods that, if possible, non-drug pain relief method. Because if you can do some non-drug pain relief method, number one, your pain can be reduced. Then you don't need to keep depending on very, very strong painkiller. Number two, hopefully your pain totally off. I have a handful of cases in my hands that they totally go off painkiller. I still remember this lady. She had surgery done quite some time ago. And again, as I say, not properly treated. She had the surgery, but not properly treated. Okay? So after the surgery, a couple of years later, endometriosis came back. And then she actually had the pain again. And slowly over time, the pain worsened. Of course, whenever she sees many gynaes, everyone asks her to go for surgery again. But she won't go. I don't blame her. She already had a surgery and she's still in pain. And the endo came back. So many I've seen. Because they didn't get a proper treatment done before. They just had a surgery, that's all. But no proper treatment done before. And as a result, the endometriosis come back. And because the endometriosis come back, they become very resistant to a second surgery. Because they lose confidence with surgery. It's like surgery also grow back before do surgery, right? So what happened is, she's already in her 40s. Every time her menses come, she admit hospital for injection. Then when she see me in the hospital, of course I will ask her to do a surgery lah. You are in her 40s already, you have so much pain, you admit hospital for painkiller. Might as well just get a surgery, remove your uterus, ovary and finish with it. I mean, that would be the logical sense, right? But not everyone will accept that. Okay, she will, typically her story is like that. She will tell me, okay, after go back, she will contact me for the surgery. And then she go back, she will change her mind. Because after period, no more pain. No more pain, so she changed her mind. So she decided maybe don't want surgery. Then next one, in pain, again admit hospital. Again and again and again and again. And then what happened was, this is my very, very first case that I tried out something different. Because if you follow enough of my videos, you will know that I have a team of therapists that is working with me. And then when I talked to my team of therapists, then we thought maybe she has a post-surgical trauma. It's trauma. After the surgery, she got trauma already. So she very scared to go back and do the surgery. So I was telling her, maybe you should try my therapist. Our intention was that to help her decide whether she want to go on surgery or, actually I gave her a second option to take Visane. To take Visane long term, I said. Because I have so many patients who take Visane long term and they're very happy, no more pain. She don't want to take Visane, you know. And then she don't want to do surgery, you know. Don't know what to do with her. Every month in and out of hospital. So my therapist said maybe she has surgical trauma. Let her see them first. So I also spoke to her. I say, go and see my therapist. Maybe you have some issues that unsettled. That's why you couldn't make the right decision for yourself. We were thinking that if I were to send her to see my therapist, she will be able to come into senses to make the right decision. Whether Visane or surgery, it doesn't really matter. She will make the decision. So after the therapy, she went for a total of 4 sessions. And then 4 months later, she came to me. So much different. She didn't admit to hospital already. And then she came to me. In fact, after the therapy started, she no longer admitted to hospital already. And then she came to me after about 4 months. And she told me that she no longer need to take any painkiller for her menstrual pain already. No need. I asked her, no pain meh? Got lah, very little. Already bearable. And guess what? She actually had a 12 centimeter adenomyosis. Adenomyoma that's 12 centimeter before the therapy. And after the therapy, it became 8 centimeter. It became 8 centimeter and she has no more pain. Minimal pain. No need painkiller. She's off painkiller. She's so happy already. Miracle, right? So I went back and asked my therapist, what do you do to her? So I also love to know what happened. Actually, they found out that her life is very stressful. And they actually help her to just alleviate her stress. Actually, they never help her in any other things except alleviate her stress. So she managed to let go all her stress, change her life. Her life, in the sense, she resigned. She found a new job. She totally changed occupation, you know. And that changed everything. No more stress, no more pain. Adenomyosis shrink. Miracle. This is the very first time I had this case. And from then onwards, whenever I have resistant cases, I usually send them to see my therapist. And I have so many cases that it has helped. And recently, I think I mentioned in my last video, last year, thankfully because of the pandemic, there is actually an international pelvic pain conference that run every year in US. They only run in US. They don't come here. So normally when there's a conference in US, we won't go, you know. It's like travel 24 hours there and then don't know how attend conference and another 24 hours back. Forget about it. So I normally don't attend conferences in US. I always wait for them to come to Europe or Asia, you know, or Australia. So there was this international pelvic pain conference last year that we attended. I didn't attend myself. I sent my therapist because I look at the program. It involved therapists and physiotherapists. That means psychological therapists and physical therapists. So two types of therapists need to attend. So I send both. I send my physiotherapist and my counseling team. I have two of them. I sent to the conference, and then after that we had a sharing session as to what they learned, and then we found out that actually your stresses in life play a very big role in the pain. And that has proven by so many cases that we have done before that. And now a lot of things make it more sensible now, because when you go for conference, a lot of theory, right? What happens? So when you suffer from period pain every month, what happens is the nerves keep stimulating the brain. Your nerve, because of the inflammation of the endometriosis, the nerve is stimulated, go out to the brain and tell the brain pain. So your brain say pain because of the nerve that's stimulated. That's how pain works. We have a lot of pain nerve. We have a lot of pain nerve all over our body. So whenever you have an injury or an inflammation, the pain nerve will be stimulated. And because it's stimulated, it brings the message all the way to the brain and go to the pain center in the brain to tell you there's pain. So that's how our body works. Because it has to process as pain before your brain can figure out how to avoid this pain or how to solve this pain, using your brain to solve the pain. So this is something that happens with everyone whenever you have any pain. When you have, what do you call that? This pain that continuously being stimulated to the brain, what will happen in your brain? Your brain will change. Actually, they have evidence, if you were to look into your brain microscopically, things actually do change. And it makes this nerve now very much more sensitive. Very much more sensitive to the pain. And another factor is how the stress makes it. Like now, let's say even if your endometriosis is already not so bad, but the pain nerve is now becoming very sensitive. So you still feel more and more pain, more and more pain, more and more pain, even though your endometriosis didn't worsen. And why it goes on to all this cycle? It is also partly because of the stress. So when you have stress, your brain cannot reprogram back to say that actually now not much problem, don't be so sensitive anymore. I cannot, because your body has a lot of stress. So what they do is they actually just need to reduce your stress. Just by reducing your stress, your nerve now will be able to realize that actually the endometriosis is not that bad. So you don't need to have so much pain. And that's how they reprogram back. Your brain can reprogram back, but if you cannot reprogram back if you're still very stressed. So that is how the whole theory about this pain in endometriosis. Why is it some women after surgery still feel pain? Because the nerve is so sensitive and they're so stressed. The nerve is so sensitive, they cannot reprogram back. We have to get rid of your stress. But sometimes, you know or not, the stress can be endometriosis itself. Many women with endometriosis are so stressed over endometriosis. But it may not be just endometriosis, it may be other things. Like this lady, she changed jobs. She not just changed jobs, she not just quit, she changed profession. She went into kindergarten teaching. She suddenly realized that she loved kids and she loved to teach children. She totally changed from one profession to another profession. And her endometriosis also shrink. Which is also something I strongly believe as well. Your stress is also the reason why your endometriosis keep progressing. Because when you're stressed, your body immune is down. How is your body going to fight this endometriosis if you are so stressed? So that is what one thing you can do. See a psychologist, a therapist, or a counselor, anyone, religious teacher, someone who can really help you with your stress. You need to be mentally stronger. That means healthier, mentally healthier, stress-free, emotionally also not so emotional, then naturally the pain will come down. During this entire conference, they also talk about few things. They talk about team approach. So endometriosis pain is not about seeing doctor for surgery only. It's not about taking Visane only. It's about seeing a psychologist to reduce your stress, which is a must. It's also about dietary changes to reduce your pain. And it is also about seeing a physiotherapist. You see, I sent my psychologist and my physiotherapist to this conference. And they also came back to share all the videos of dietary changes as well. So it involves so many things. So that is why ever since we had this sharing session, I have changed a bit on my approach of things in my clinic. In the past, I just, as a doctor, we only either do surgery or give medicine. Then ever since I knew from that very first case of mine, where just by going to see my therapist and my counselors, she managed to be pain-free and medication-free. So I have already started this counseling service for endometriosis, whether for those in pain or for those post-op, which is something I offered to almost every one of them. For a couple of years already, I've been doing that, and I have been seeing very good results. And now I see even more things that I can do because I have a dietitian in my clinic as well, and I have a physiotherapist. So let's do a complete treatment. So what I do now is I also send them to see my dietitian. So many of you like to ask, what food? Yes. Does dietary in fact affect endometriosis? Yes, in two different aspects. One is we talk about anti-inflammatory diet. Anti-inflammatory diet, because I was telling you just now that endometriosis is an inflammation. So you take painkiller like Voltaren, which is anti-inflammatory. But there are also anti-inflammatory diet. But same thing, if you take an anti-inflammatory diet, you are more or less the same as the people who take painkiller. Because we reduce your pain, but your disease progress will still progress. It doesn't stop the disease from progressing, but it reduces the pain. Compared to if I go for counseling. When I go for counseling or I see my therapist, not just my pain come down, my disease progress is also controlled. But anti-inflammatory diet only helps in reducing pain. So the first thing you can do is anti-inflammatory. So now my dietitian already have all her ready. When she sees my patients, she'll tell all the anti-inflammatory diet. So she goes through all your regular food that you eat day to day, and from there she'll point out what are the food that you like to eat actually, that you eat every day, that is causing you more pain. And the other thing is, you see, for treatment of endometriosis, which I mentioned in my last video, is mainly progesterone. Women have two hormones, estrogen and progesterone. Estrogen makes endometriosis worse. Progesterone cures endometriosis. That's why you take Visane, you take Depo, you put Mirena. All these are all progesterone. So if you go on progesterone, it actually controls endometriosis. And like Visane, it can treat endometriosis. So if you have such a strong dose of progesterone, you can also treat endometriosis. And so what we need now is, because in the day-to-day food that we eat every day, there are food with estrogen and there are food with progesterone. So we have to adjust our diet a bit to reduce our estrogen intake and increase our progesterone intake. In that way also, you can control your disease progress up to a certain extent. Definitely helps up to a certain extent. Recently, one of my patient also, that's what she went on. She didn't go on anti-inflammatory diet, but she went on low estrogen, high progesterone diet, and her cyst shrink. But as I always mention, the same with when you take Visane, or now you take high progesterone diet, things will shrink, but disease is always there. That's why you try stopping your Visane, your cyst grows back quite fast. So the disease is actually still there. Just that everything shrink and become less active. Progesterone suppresses the endometriosis, but it doesn't get rid of the endometriosis. But that is, to certain people, more than enough. Because as long as I can keep on suppressing my endometriosis, then it's fine to a lot of people. So that's why I always tell a lot of women, don't simply take supplements. Don't simply take supplements that make you beautiful and young. Because things that make you beautiful and young naturally have hormones. They naturally have hormones and they tend to be estrogen. And that is not good for endometriosis. And if you ask me what will progesterone do to you, doesn't make you so beautiful. Sad to say, but what to do? Endometriosis, we want high progesterone, low estrogen. Okay? And the last person to see is my physiotherapist. Physiotherapist, how does it help? Why does it help? Because whenever you have pain in any part of your body, whenever you have pain, what is your immediate reaction? You actually tighten your muscle. Let's say when someone massage for you, I'm sure a lot of people have experienced massage, right? When you enjoy your massage, your muscle is also lax. But if you find the massage so painful, you actually tighten your muscle. That is the reaction, natural reaction to pain. So whenever you have menstrual pain, you tighten the muscle. And if you do it so regularly, every month for so many days, you tighten all your muscle, I'm quite sure when you have menstrual pain, if you press your tummy, it's so hard. When you have no menstrual pain, your tummy is soft. So we actually tighten a lot of our pelvic muscles. And you will also know that muscles that are tight also tend to cause soreness. So sometimes, maybe the endometriosis pain is not there anymore. But you still continue to have pain because your muscles are all tight. So it's still sore. So what a physiotherapist does is, the physiotherapist will help you to relax back all the muscles that are tightened around your pelvis. So that's what they do. So physiotherapist has a role in pain relief. Dietitian has a role in pain relief. Psychologists have a role in pain relief. And that is why for my clinic now, whenever I do a surgery for an advanced stage endometriosis, I send all of them to see this team of people in my clinic. My team. My pain team. I have a pain team in my clinic. And we call it pain complementary therapy. So it's a pain complementary therapy. Not just for those who have done surgery, but also those who are already in pain, but they opt not to go for surgery. I also send them there. Because I believe that if I do this, your pain will be away faster. And number two, it also helps in reducing the size of your cysts or your whatever, your adenomyosis or whatever. And if you have done a surgery, I don't want your pain to come back. I don't want your endometriosis to come back. So one of the ways is to have a complete treatment for you. So we supplement the surgery with all other things that will help. So that is what we call a complete treatment. A complete treatment, if you look at my previous video, previously, before I started this pain relief program, a complete treatment involves either a surgery or medication or both. If you have surgery, you also need to get a complete, the right surgery, honestly. I always say the right surgery is very important. And after a surgery, you need to be on some maintenance therapy. That's what I always tell everyone. And if you choose not to do a surgery, you just want to go on Visane, no problem. But you also need to understand that after you take your Visane, when your cysts have shrink and disappear, you do not stop just there. You still need to continue with maintenance therapy. And on top of that, we help you make sure your stress is gone. Diet change, lifelong, and physiotherapy. So this is the complete treatment of endometriosis. So for me, I had my endometriosis surgery 20 years back. But for me, I didn't get any of this complete therapy. But I had surgery and I had maintenance therapy. I am on maintenance therapy all my years, even until today. Don't plan to stop it. I'm not letting my endometriosis come back again. Understand? So this is what I mean. So there are alternatives, like this question from this lady. If she doesn't want to take painkiller, I don't know why she doesn't want to get a proper treatment done, either by taking Visane or by going for a proper surgery, going for the right surgery. If she doesn't want that for some reason, then pain is the only problem she is having. Then pain is the only trouble she has, and she wants to just get rid of the pain. You know, some people just don't want the pain. They don't care about the adeno and the cysts and everything. Just like that lady of mine that I mentioned, the 12 cm adenomyosis that turned into 8 centimeter. She's not bothered with the adenomyosis. She's only bothered with the pain. Partly it's because she always think, no, I'm in my 40s, another few more years I'm going to menopause. If I got no more pain, that's enough already lah. Another few years I'll menopause and my adeno will shrink anyway. So if you have that in mind, the answer is not painkiller. The answer is, as I mentioned, that 3 therapy I mentioned. See my counselor, see my dietitian, and see my physiotherapist. That's what they do. Exactly what they do in details, I know roughly, but not into depth. That's their field. I leave it to them. I always feel that even if a doctor knows what is the right exercise to teach you, the physiotherapist always teach better. Let the physiotherapist teach you, not your doctor. So it is their field, leave it to them. So same with dietitian. I'm not the best person to tell you what to eat and what not to eat. See my dietitian. They are the best. And they don't just give you a list and tell you, no, go back, go eat this, eat that. They analyze the food you eat. Because you must understand, I can tell you don't eat this, don't eat that, but sometimes you don't realize, that some of the ththings inside there have that thing. It's like I always tell patients, your sugar is too high, you better cut down on your sugar. You're pregnant now, you have it looks like you have high sugar, you need to control your sugar. And then they'll tell you, I control. And then you ask them, when you go and look through, they're still eating fruits. Then they'll tell me, hey, fruits cannot eat I thought fruits is healthy. Fruits is healthy, but fruit is sweet. When you cut down on sugar, you cut down on fruits too, Alright, so something like that. So sometimes when we tell you what to cut down, what to take, but the exact thing is also better for them to analyze your usual meal, because they cater to your meal. I can tell you something, but maybe there's something that you cannot swallow. Oh, you look at the thing, I cannot swallow. Then even if it's good for you, you may not be able to eat it. So sometimes the dietitian is the one who can actually look at what are the things you usually eat, what do you usually like to eat, and then from there they can adjust and able to advise what is anti-inflammatory diet good for endometriosis, what is low estrogen, what is high progesterone. Okay? See my dietitian, see my therapist. So that is complete. Okay, so much for the first question. Oh, it's already 45 minutes. Alright, so I'm going to try and get some shorter questions, hopefully. Okay, this is from my Facebook. I think last week she asked. Shaidato asked, Doctor, now I'm on Depo, but I really want to have children. So I think last week we covered about Depo. And yes, Depo definitely works well for endometriosis because it's a progesterone, okay? But she wants to have children. I don't know what to do, because when I think back, when I still have my endo, I will be in so much pain and it's stressing me out. So basically, she knows that she has endometriosis. And she's on Depo, so that's well. So she has no period pain, she's good. But she wants to have baby. But she knows that if she's going to stop the Depo, the pain is going to come back. And she's so stressed thinking about facing the pain again. So in this case, she has only two options. In fact, I would prefer the first one is to go for the surgery and get rid of your your endometriosis. Why? Is because I also worry that the endometriosis will not allow you to get pregnant. So that is one option. It's actually to go for the right surgery. Clear all the endometriosis so you have no more pain after that. Of course, I would like to say even better, go for the surgery and then go for my pain complementary therapy, so that even after the surgery, you will definitely have no more pain already. But alternative number 2 is the pain complementary program that I have. Go and see the therapist, get your stress sorted out, see my dietitian, get the right diet, and see my physiotherapist to learn to relax the muscles that are involved. So do all this, I believe the pain will reduce. Because even with counseling, I've seen so many cases, the pain has gone. So she basically has two options. One is just go for the surgery so that she has no more pain after that and then she can get pregnant. That's one. Or else, go for this therapy first, complete the 4 sessions, total 4 sessions. Complete all 4 sessions and then stop the Depo, go and try and get pregnant. If you're pregnant, well, fine. If not pregnant, go for surgery. Because we worry that the endo don't let you pregnant. But the wrong thing to do is, there's a wrong thing. Don't just go for pain relief therapy and yet you're not pregnant and wait for many years for the baby. I think that is a very common mistake. Endometriosis has a chance of coming back. And we always worry that it may come back. So if let's say you go for this therapy, pain complementary therapy, and you're pain free already. But after 1 year, 2 years, if you're still not pregnant, don't keep waiting. In fact, for me, I feel by 6 months to 1 year, if she's not pregnant, she should go for surgery. If she doesn't want to go for a surgery, wait for 1 more year. If she's still not pregnant, please go back on your Depo. Don't take chances. Don't take chances. Because I somehow believe that even if you're on high progesterone diet, you can't sustain. You can't sustain that for the rest of your life. So it's better you go back on Depo. That's my opinion for her. Okay, so sometimes you must understand, although we see certain things work on certain people, but not necessarily everything works on everybody. So endometriosis is quite a horrible disease to have. I'm sure many of you know the pain is horrendous. Why would we want to give it a chance to come back? Don't want. I want myself to be armed fully. If I clear all my disease, I don't need anti-inflammatory. I can eat what I want. Because I have no reason to have inflammation in the first place. Because I have no more endometriosis. So if I clear my disease with the right surgery, or I clear my disease because I already took Visane for so long, I have no more inflammation, I have no worries. I take high, if you're talking about stress, Like for example, for me, because I all along never knew about counseling and diet and all these last few years. I have endometriosis for 20 years ago. But all I did was maintenance treatment and nothing came back. Never came back for 20 years. So that's why I always believe that you should arm yourself with everything. You should have everything. You should not just depend on one. What if it doesn't work on you? What if that one doesn't work on you? Then your disease come back how? So it's better, you still need to be on maintenance therapy. You still need to take care of your diet. You still need to go and see the counselor to make sure you're stress-free. You still need to know all the things that you can do to relax the muscles of your pelvis. So this is something you need to do. But maybe not forever. If you're already not in pain for a long time, your muscle will not be tense already. So, but stress can trigger endometriosis to come back. Hormones can trigger endometriosis to come back. So these two things are still something you need to be on for the rest of your life until you menopause. This is my opinion. Okay? So, alright. So that is the answer for Saidato. Okay, let's see if I have another short question here. Adil asked about her endometriosis. She said, endometriosis saya lekat dengan Caesar scar. Oh, this is also a very common problem. I've seen quite a lot. You have endometriosis. Maybe you have not too much endometriosis, or maybe you don't have endometriosis. You can still have endometriosis of your Caesar scar after your surgery for a Caesar. So that is quite a common complication of Cesarean. How to solve that problem? Very easy one. Actually, just remove. I mean, you can also be on Visane for the rest of your life. But removing is like so much easier because it is outside. It's outside. It's not a surgery that go deep in, you know. Usually the endometriosis of the Caesar scar is just below your skin. So I just need to make a small hole, go below your skin and just remove it and solve the problem once and for all. Although I notice a lot of patients, because they just after a Caesar, they just give birth, they're very traumatized, give birth, Caesar operation, they're actually very resistant to doing a surgery to remove the Caesar scar endometriosis one. But I noticed that if you want to take on medication, until when you take on medication, and then eventually you're going to stop anyway because you want to get pregnant for the next baby, for example. So just remove it. It's a very small surgery. And because it's so superficial, it's not very painful lah. You know, and your recovery is very fast because don't even go in. And also it is not high risk because I don't go inside your tummy and just below the skin. So it's very small surgery, very easy to do, and it solves the problem once and for all. Especially a lot of women with Caesar scar endometriosis, they don't actually have endometriosis. They only have Caesar scar endometriosis. So in this group of people, it's very easy to treat them. Just get rid of that small little endometriosis inside them, and that solves their problem. Okay? So I've answered all the questions for today. I noticed there's so many questions posted up by you all in the comment section. But unfortunately today, I think we talked a bit too heavy. There's a lot of things I talk about, I feel today. Enough knowledge for one video. Let's not bombard you with too much, after you cannot absorb. So enough, really enough story, facts that I shared today in one video. Okay, just go through and see whether unless you have some simple things to ask me. Hi, you're not asking a question, you just say hi. Okay, hi. Good evening, Diane. Good evening, Joey. So let's see. A lot of you are talking about your skin being itchy with Visan. Skin being itchy with Visan is quite a common side effect. Should you stop? But we know that once you stop Visan, you will come back. You won't stop, you change. You change to something else and then change back to Visan. That you can do. You can always change and change the other one. Okay, but don't stop. Because stop, very fast come back one, you know, endo. Don't stop. But you can change, okay? You can change. Okay. But I notice a lot of women who are really suffering from endometriosis, they actually don't mind the itchiness. They say I'd rather itchy than having the pain again. So yeah, sad to know that. But alternatively is to go for surgery lor, then if you don't want to face the itchiness. But as most of them say, like, itchy is better than pain. I agree. Hi Amy. Hi Azlin. Alright. So Azlin asked me what is the proper treatment after surgery. So that's my answer. After surgery, you need to be on maintenance therapy. A proper treatment for endometriosis includes, number one, the right surgery. Please go through my other videos in my YouTube channel to know what I mean by the right surgery. Number two, follow my maintenance therapy, which will be some low dose progesterone. Now you don't need to take Visane so high dose, you just need low dose. You need maintenance therapy. Sometimes after surgery, maybe you go on short-term Visane or short-term Lucrin or Lupron or Zoladex. That one is still part of the main treatment, but you need maintenance treatment, which is low-dose progesterone for until you menopause. And go for your counseling to get rid of your stress. Learn about the diets that you need to adjust, and also go and see the physiotherapist to release all the muscles that are involved. So that is a complete post-surgery treatment. Okay. Olina Lee asks, can you differentiate between Depo-Provera and progesterone and Visane? Depo-Provera and Visane, they're all progesterone. Only difference is the strength and what they're licensed for. Visane is very much licensed, is specifically licensed for endometriosis. So the strength for Visane, when it comes to endometriosis, is very effective. Depo-Provera is licensed for contraception. As a contraception, is very effective. Visane, not really as effective as Depo-Provera when it comes to contraception. But Depo-Provera is not so effective for endometriosis. So when it comes to endometriosis, Depo-Provera, I would categorize is more for either maintenance therapy or control of endometriosis, not to treat your endometriosis. Treating endometriosis, you need Visane. Amy said, Dr. Tan, COVID virus making life more stressful. Very true. Very true to a lot of people. That's why one thing we know, stress is very much related, cause a lot of illnesses. Trust me, this 1 year of COVID-19, they actually have a lot more cancer, a lot of late stage cancer also. They progress very fast, and a lot of queer cancer. These few months itself, I've seen a few cancers that I've not seen all my life. I've only read it in the book. It doesn't even come out in my exams because it's so rare. And I see it this year in the pandemic year. And I'm not the only one who is saying that. A lot of my other colleagues, even from others, not gynae, they see that as well. A lot of queer cancer that usually don't happen now. A lot of women come with straight away stage 4 cancer because cancer also seems to progress faster because of the stress. And in fact, cancer is very much stress related as well. A lot more heart attacks and death from heart attacks now during the pandemic as well. And they are all stress related. The problem is, if you are stressed, why do you just keep quiet? There are people like my therapists. There's so many therapists out there. They earn a living helping you letting go all your stress. Get professional help. For me personally, I've also seen therapists a lot. Get professional help. Then life will be happier. Life will be less stressful and happier. Go and get their help. Don't just live with the stress. So Olina also asked about food, which I've already explained. Amy asked how to make appointment with my dietitian. As usual, just make appointment to see me first, or you use the same number to, because most of my dietitian, they don't have direct appointments, they all go through me. So you need to approach my staff first Amy, you are my patient. You can always ask my staff first that you want to see my dietitian. Why? Is because they have to see me first to come out with the diagnosis before my dietitian can give the right advice. So if I label you with a diagnosis of endometriosis, then only my dietitian will know what to do. Fatin asked, what do you eat? Or you ask my dietitian, you don't ask me. Whole long list of things. Ask her. Carissa Yo asks, are all these treatment covered by insurance? Number one, all this treatment, only surgery is covered by insurance, I think. If your insurance cover hospitalization. If your insurance cover clinic and outpatient, yeah, then all these things is covered, definitely. No, Khatija asks, oh yeah, the one is quite complicated. I leave the complicated questions to another day. Vivian asks whether you would advise to drink plenty of soybeans for our hormones. Dear, soybeans is estrogen, yeah. So for endometriosis, no. No to soybeans. Alright. Amy asked that if I have adenomyosis, is it okay to take Yasmin? Because Yasmin has estrogen. Honestly, my answer for you is no. But Yasmin actually helps in Yasmin you have estrogen and progesterone. So if you're thinking of treating your adenomyosis, is not Yasmin. It has to be pure progesterone. But if you're talking about control of disease or prevention of disease, can, because Yasmin is both, it has both. So 1 plus, you plus 1, you minus 1, it becomes 0. So actually has no effect. So actually it does work as well to certain people. But for those people who are very bad endometriosis, we will normally don't give Yasmin. We usually give Yasmin when we don't think it's so bad. So then all you need is some maintenance therapy. Okay. Alright. I think that's all for today. The rest of the questions that you asked, it's not that I do not want to answer, but answer needs time. Some of your questions are a lot heavier, and definitely we need more time. That will be in the future episodes, okay? So once again, if you have missed my previous videos, please go to my YouTube channel and subscribe to my YouTube channel. Turn on the notification button, and also view all the previous videos on endometriosis. I love endometriosis. I have lots of endometriosis videos. Okay, and if you have any more questions, you are free to put it down in the comment section, and I will keep all your questions for my future episodes. Alright, and hopefully all of us will not get COVID, and we will get vaccinated and be free from this whole pandemic thing as fast as possible. Okay, all the best to all of you. Happy New Year. Bye.